Hi. Probably the main nutritional problem in today's society is obesity. So why do we consider obesity a problem? Why are we concerned about obesity? And the main reason is that obesity is associated with increased risk of dying. We call that mortality. And there's a clear relationship between your BMI as a measure of obesity and the risk of dying. And this risk especially goes up beyond a BMI of 30. Now, there are a number of conditions that are associated with obesity. In fact, there are many. And the most important one is diabetes. It is very well established that being obese greatly increases your risk of developing type 2 diabetes. In addition, cardiovascular disease risk is also elevated with obesity, as are many other diseases. There is sleep apnea, there is stroke, pancreatitis, arthritis, and in contrast to many people's perception, cancer, because we know that risk for breast cancer and colon cancer is significantly increased in people with obesity. Now, there's a lot of talk about healthy obese. Are there actually people that are obese but are still healthy? And that's actually not very clear. We think this may actually be a very, very small minority, so that there's always some even minor metabolic disturbance in people that carry too much body weight. Now, the main metabolic disturbances that you see in people with obesity have been collected into one particular syndrome that we call the metabolic syndrome. It refers to a collection of symptoms that often co-occur in one individual. And the most common characteristic of metabolic syndrome is what we call abdominal obesity. So carrying excess body weight, especially around the abdomen. Other criteria for metabolic syndrome are hypertension, having high blood pressure, having high blood cholesterol and high triglycerides, which we often refer to as dyslipidemia. And finally, what happens when people are obese is that their bodies become less sensitive to the effects of insulin. And we call this insulin insensitivity or insulin resistance. And often this is a pre-stage for future development of type 2 diabetes. So, in short, obesity is a big problem. Many people in the world suffer from this problem. And the reason why we are concerned and the medical community is concerned is because obesity increases the risk for various diseases. The most important problem that we probably will encounter in the next couple of years is diabetes type 2, which is expected to greatly proliferate in the next couple of years in many countries around the world.